Ready to get rolling there, guys?
Mm-hmm.
Okay. Hey everyone, welcome back to another episode of RCCSS Chats. Thank you for taking the time to join us. Before we do get rolling into tonight's episode, I would like to take the time to talk about an upcoming conference that the RCCSS is putting on. It's called MOVE, the Psychology, Biomechanics, and Neurophysiological Implications of Human Movement. This is our first ever virtual conference and is taking place on Sunday, November 8th. You do not want to miss out on the conference. First up, the lineup is sick. We have world-renowned speakers, including the RCCSSC's very own Dr. Andrea Spina and Dr. Mike Chivers, as well as Craig Liebenson, Brett Bartholomew, and Nick Winkleman, just to name a few. Secondly, the price is great. The virtual format has allowed for the conference registration to be lowered to just $125 Canadian. And lastly, the conference is open to everyone. You do not need to be an RCCSS fellow. You don't even need to be a chiropractor, and you don't even need to be in Canada. This conference is for everyone. So just go to www.rccsssc.ca to register today.
Okay, guys, so I'm just going to go over the ground rules for the session today. It's going to be the same as previous webinars. This is a live session, and we will be recording it and uploading it to YouTube and other social media platforms. So throughout the interview, if you have any questions, please send them in the chat box, and I'll moderate that for the question and answer portion of the interview. If I'm able to, I'll try and get them in if there's anything as we are going through the interview as well.
Okay. Last time Jeff Cubos asked the audience members to turn on their video. So if you felt comfortable doing that, I think that's a great recommendation. So we like to see your faces as well. And I'd like to now introduce our next guest, Dr. Janice Drover. She's a sports chiropractor from St. John's, Newfoundland, has a Bachelor of Science in Human Kinetics from Ottawa U, and attended CMCC for both her Doctor of Chiropractic and Sports Sciences program. Janice is a boss. First off, she's the past president of the RCCSS in Canada and has been very busy working at the highest level of sport. She's represented Canada as part of the health services team for the Commonwealth Games and Pan Am Games. She's been traveling with the Canada Soccer Men's National Program since 2018, and she's the team chiropractor for the ECHL Newfoundland Growlers. She's also spent 3 seasons working with the St. John's Edge NBL basketball team. And last but not least, she's been selected as part of the health services team for the Tokyo Olympics. Yeah, way to go, Janice. Thank you for taking the time to join us here tonight. Sounds like there's not a lot of free time between all those things you're doing.
Oh, well, this is actually a good time of night to come on. I think I just finished folding 10 loads of laundry and got the kitchen cleaned up.
Those are the things that don't get the mention in the highlight reel, but definitely important parts of life still.
Yeah, for sure.
So first off, congratulations on your selection to part of the health services team for the Tokyo Olympics. This must be something you'd be incredibly proud of. I know the RCCSS is very proud to have someone like you representing our organization at the highest level of sport. It's people like you that will hopefully pave the way for other sports chiropractors, potentially like myself one day, to work in these positions. Has the Olympics always been a goal for you?
So the Olympics has probably been a goal of mine since I started university. So I'm from Newfoundland, and I did my, not knowing kind of really what I wanted to do, did my first year in general studies at Memorial. And as that year went on, I used to ski a lot, and I ended up with a good dose of mono at Christmas, which led me to a whole semester where I could do nothing but go to school, and ended up in the career center looking for different opportunities and different kind of programs that I might want to do. At the time at Memorial, we didn't have a human kinetics and recreation department. It was just phys ed. But I had happened upon the course catalog for the University of Ottawa, and I had a friend of mine that I used to ski with from Ontario who was at Ottawa U doing kin. So through the jigs and the reels of it, that's where I ended up. And very shortly after I transferred to Ottawa U, I started working in the student athletic therapy clinic. And that was kind of my first kind of eye-opening foray that there was therapists that traveled to games and this had happened. I've been an Olympic junkie since I can remember. My aunt gave, I still have the towel from the 1984 Olympics sitting in my garage that my aunt gave me when they were in LA. So we had an athletic therapist there at the time named Dave Barry, and he was, while I was there, selected for the Pan Am team. And that was kind of the first time I was like, oh, well, this is kind of something you can do. Graduating from university, I applied to physio chiro and was accepted into the athletic therapy program. And I got into all 3 programs and had to make the decision of what was I going to do. I didn't know the path for the other directions. My sister was in chiropractic college at the time. She's 2 years older than me. And I knew that there was a sports sciences program at CMCC that I could do when I finished. So I entered CMCC as an undergrad fully with the intention of doing the sports sciences program when I finished. So that was kind of where it had all started. And then the path was kind of long and windy to kind of get there. 20 years in the making and a few zigs and zags along the way. It's interesting. We can get into that more, but when I did my residency, I was working in Calgary and I was working with Dr. Greg Uchas. And Greg had been at the Olympics. He was working with bobsleigh and skeleton. And I had an offer on the table for a job. I was working a little bit with Greg with some track and field stuff and with bobsleigh. And then, that would have taken me to the Olympics much sooner than I'm going now. But my grandmother died and my sister found out she was pregnant. So it was the decision of, where do you want to live? What do you want your life to look like? And, situations changed and here I am, probably, that was 2002, 18 years later, finally getting there. So.
Well, it's good you stuck with it, even though it wasn't the most direct route for you. It sounds like it was the best thing for your life overall.
Mm-hmm.
So you must have some pretty mixed emotions going on with what's been happening with COVID. How have you been feeling about the upcoming Olympics?
So, it's really interesting because it's one of those things you spend your whole life trying to get somewhere and you finally get there and then the plug gets pulled. So it's a little disheartening at first and disappointing to know that the games are not going to be what we anticipated them to be if they do occur. The other flip side of it is that we have a really great medical team that has made up the team with the COC, and it's kind of proud to be part of a team that actually made the call, which eventually led to the cancellation of the 2020 games. Mm-hmm. Our leaders at the top, Dr. Mike Wilkinson, he's the chief medical director for the COC right now, is a guy from very, very brilliant physician. He works in Vancouver, and his group have had to make some really tough decisions to protect our Canadian athletes. And pretty much that's what we all do. Like our first and foremost job is to protect the health and safety of our team and our staff in these environments. So it's pretty cool to be part of the team that actually led to the full cancellation of that event. What it's going to look like for 2021, we have some best guesses. The COC definitely has plans in place, but not a lot of information has been released from the IOC yet, or from the OCOG, which is the organizing committee from Tokyo. So it's, nerve-wracking a little bit to know that you're going into games where in an athlete's village, there's going to be 18,000 people and you don't know if most of the countries are going to take the same COVID precautions that our team will. The big countries, you can be pretty guaranteed will be on the same page: Australia, USA, Canada, New Zealand, probably some of the bigger European countries. But when you're talking a lot of the small countries that are going, they may not have the resources or the skills to be able to plan properly for how to deal with COVID in this situation. And as we all know, the situation is so fluid and it's changing on such a day-to-day basis that where we are now 6 months in and where we are 6 months from now may be two completely different places. So
absolutely. When it did come down to that call from the Canadian Olympic Committee, were you guys privy to the information, or did you kind of find out like the rest of us that we weren't going to be sending our team?
My phone blew up when it got released to the news.
Yeah. So
literally, and that's a lot of kind of confidential information that, I'm not that far up the chain to kind of be in on that.
Yeah.
So we all everybody's phone blew up around the same hour. I think it was about 10:30 at night for me here. And then the kind of group chat gets going of, wow, did you know, and we kind of thought it was coming, it wasn't really a shock or surprise, and it's still, there's part of me doesn't understand how this is going to go in 2021 either. So, and then shortly after that, the releases came out from COC and from our HST leads and stuff.
Yeah. And like, has the COC been continuing to communicate with you guys as to what their best guess is, or is it kind of, these are like, hold off until this date and then we'll?
No, we're in communication with them. Like, they've been pretty forthright with us. We were all given the opportunity to recommit or to pull out with no penalty for, acceptance for future games. COVID is a different situation for everybody. Some of my colleagues have young children, some have older parents in long-term care. Everybody's situation is different. We don't know what the quarantine rules are going to be. We don't know, a lot of the nitty-gritty on what'll happen if somebody gets sick. There's big picture stuff in place, but that's information will start kind of coming out in the new year, I would think.
Yeah, I mean, it's been, even with the RCCSS putting out the call for major games upcoming too, it's pretty interesting to see like that stuff still being planned, even though we don't necessarily know what the future is going to look like yet, as far as the Pan Am Games and Commonwealth coming up in Beijing as well.
Yeah, and it's interesting because really the planning for Tokyo was done a year ago, and they had, our health services team had moved on to planning for Beijing and what has to happen for Beijing. Mm-hmm. A 4-year cycle for planning for games is no different than an athlete training in a 4-year cycle. So, by the time we actually get to the games, the hard work is done. Then it's just kind of the execution point. So now it's that, they're fully planning for Beijing right now, and Tokyo is just kind of on hold until they get more information.
Yeah.
Okay, Janice, we're going to switch gears a little bit because you're the first female we've had on this podcast, and I'm excited to be able to pick your brain a little bit as a female in the field of sports chiropractic. So as you know, I'm a new mom, and so I'm kind of figuring out all the juggling that goes along with keeping things moving at home, in clinic, and in other various projects that we inevitably have. How do you balance all those things? So being a mom, business owner, being on the road with different sports teams.
How do I balance?
Or do you balance them?
Not very well some days. Some days I'm like the boss and I get it all done. And some days it's a disaster, quite frankly. I mean, jokes aside, you have to have good people around you. I wouldn't be able to do what I do without the support of my family. My husband's a chiropractor as well. And thankfully he's an excellent family practice chiropractor who has no interest in traveling and loves being in clinical practice. So that's one piece that works for me. So I have my own locum. Our practice is actually my sister and I and both of our husbands. We're all chiropractors.
Cool.
And we have some massage therapists that work with us as well. So our setup is a little different in that it takes that whole stress of associateships or partners, or, we're 4 equal business partners. And like I said, I have my own locum. So when I go, Eric often will work extra days for me. The other thing with him is he tends to see patients faster than I do. So he can usually cover off a lot of my practice for the people that will see him when I'm gone. But the other thing is I don't work full time when I'm home. So I work 3 days a week. I don't work 5 days a week. Now I do 3 longer days. Like I do 2 days where I work between 10 and 12 hours and 1 day where I work a normal work day. So I kind of jam a full work week into 3 days. Because then that gives me 4 days a week where I can do the other stuff. So Eric and I, we have 2 kids. Julia's 14 and Peter's 9. No, he's 11. He's born in 2009. He's 11. So grade 6 and grade 9. And it's a lot easier now because they're pretty independent kids. So, they can make their own breakfast. They make their own lunch. They can get themselves dressed. They can, do a lot of that busy work that when you have young kids is quite difficult. I was thinking about this earlier, knowing you might ask this question, and I think back to 2010 when Vancouver, the Van Games, and Peter was born in 2009, and as part of to be part of that pool for the Vancouver Games, you had to fly to Halifax and have an interview with somebody from the organizing committee from VANOC. And he was probably 2 months old. I was still nursing. So I remember getting up in that morning, hopping on the plane with a backpack and a breast pump, and going to this interview, and then pumping and dumping along the way and hopping back on a flight at 11 o'clock that night. Because it was, it was that part of me that this was an opportunity that we had, and it was part of the protocol, to go work for the organizing committee for Vancouver. And I didn't want to miss out because I was a new mom. So breast pump on board, and on I went, and was, over and back in 12 hours. So
yeah, you just do what you have to do, right? To get it.
But, the big thing is kind of organizing your schedule so that you can do the things that you want to do. There's a lot of stuff when my kids were little that I couldn't do. So I didn't travel, besides the Vancouver Games. No, see, that's not true. I did travel. I did Vancouver Games, and I did the 2011 Canada Games in Halifax. Brian Seaman, who's on our call tonight, was the director of medical services for that. And I was the chiropractor that worked at the satellite clinic in Truro. So that was about, I think it was gone 2.5 or 3 weeks. So at that point, Peter was 2. And
that's a long time though, at that age.
It is a long time. And it's, at that age, they don't understand that you're gone, right. They'll see you on FaceTime, they don't. So, you wonder sometimes if that's actually better than when they get a little bit older and they kind of have that separation anxiety and know when you go. Now, when I travel, it's probably worse for me because I might have a day where I'm feeling low and I want to see the kids, and I try to FaceTime and they're like, yeah, mom, gotta go.
Yeah, I'm busy. I have stuff to do.
Play a Fortnite. I'm doing this. I'm talking to my friends. And you're like, but, and they're like, no. So I also have a very supportive extended family that help out a lot. So my parents pitch it a lot for me when I'm gone, especially with driving. My kids are kind of those overscheduled kids who do everything. And, because we do. And so there involves a lot of driving. We live about 15 minutes outside the city. So I make sure the oil and gas industry in Newfoundland continues by how much gas I burn in front of a day. So mom and dad help a lot. And I live next door to my sister. So
that's so fun.
Yeah. So it's helpful. So, without that kind of support, it's not as easy to do those kinds of things. Some of the guys I travel with are on this call and they may disagree with me, but it's one thing when dad's gone, but it's a different thing when mom is gone. So the calls that I get when we're on the road sometimes are like, where are my socks? Where are my black tights? Does anyone know what, stuff like that. That's a bit different. Those, even though I have a husband who does a ton, there are certain things that,
you just know.
You just know. Where the steak spice is in the cupboard, or what's in the back of the fridge. So that's the biggest thing is, finding a way. So if you want to continue to do it, finding those support systems so that you can do it. And then so that when you go away, you're not constantly worried about what's happening at home. Part of you does, because that's who we are, but knowing at the end of the day, I have good people at home and it's going to happen. It's not going to be the same as how I do it. And that's another big piece, is that it's not going to be the same as how I do it, but it's going to get done. Yep. So I used to leave with very detailed, like 5-page do-a-tang papered, detailed schedules, literally to the hour of each day. It looked like it color coded with different highlighters for different kids, who had to be where, when, what bags they had to have, what bags they needed to you know, it would take me about a week to kind of get these schedules sorted out before I went, especially when you go for games. So like Australia, the Commonwealth Games, Pan Am Games, Olympics are all a 4-week commitment. So there's a lot that can happen in that time. Now we all have a shared Google Calendar. That works really well. And everybody has phones, so it makes it a little bit easier.
That's awesome.
Yeah.
So are there any unique challenges that you've encountered being a female in a male dominant field, just in working with different teams that are primarily men's teams?
You know, in the beginning I did. So I'm 20 years at this now. And how men's sport dealt with women 20 years ago and how men's sport deals with female staff right now are in two completely different places. When I was in my residency and I traveled with soccer, and my soccer experience has primarily, I did work with some women's teams, but it's primarily been with men. So I was with the Calgary Storm and with the Toronto Lynx. Oftentimes, and most of the time, even still, I'm the only female that's on the road with these teams. The difference now is that I get my own room. There were times due to budgetary constraints and poor planning that I had been told I was sharing a hotel room with a male coach. And when I look back on it today, I was like 25 and, you know, you're just doing your job. And that would never happen today. Absolutely never. Never at all. But what I find is there's a really interesting role for women on the staff of males teams. It levels out the treatment room a little bit. It changes things. So we still have banter and we still have conversations that some days should never happen in public. But then at the other time, I'm a bit of a soft spot place to land. So I think back to when I first started with the St. John's Edge, we had a bunch of guys from the States coming to Newfoundland. So you're going to an island in the middle of the North Atlantic. Half of these guys were NCAA basketball players from the South who had never seen snow before, you know, and Newfoundland is not that ethnically diverse. So at the same time, not a lot of Black guys who were 6-7 feet tall walking around St. John's, Newfoundland. So it was a bit of a culture shock for those guys when they came here. And a lot of those, though they had a good experience, some of them were having struggles at home. So, you know, you have children at home, you have kids at home, you have blended families, you know, your family doesn't understand where you are. And I was the medical director that year for that team. And I had one player in particular who was having a lot of family problems at home. And there were a couple times that he would just walk in the treatment room and stick his head on my shoulder and burst into tears. And at the end of the season, he said to me, I would never have made it through this season if it wasn't for you. If we had had a male lead therapist, I would be gone home. Because that soft space to land. Because I was a mom, I had kids, I could understand what he was talking about. I could understand. It just creates a little bit of a different dynamic. I find that on the road with Canada Soccer too. We have an amazing medical team with Canada Soccer. It's multidisciplinary. There's myself, Dave Blatt's an athletic therapist, Greg Bay, he's a physiotherapist, Dave Simons, our doc who usually travels with us, an orthopedic surgeon from Ottawa. And we all bring different personalities to the table. And depending on the day, guys will gravitate to either one of us based on what they need. So we have some guys who are younger, who I'm less intimidating than maybe, you know, Greg Bay is one of the most experienced physios we have in Canada. The guy's brilliant. He may be a little bit intimidating for some people, for the younger kids. And he's been with the program since 1984. Some of the older guys prefer dealing with him. Some of the guys who have kids, you know, I might be the one they talk to at the end of the night because I can sit and treat them and talk about their 2-year-old, you know, so it gives them that kind of space. So it brings an interesting dynamic in that it kind of changes the energy in the room sometimes. And depending on who needs what when, then they have the choice of what therapists they're going to work with. Working with John Herdman, who came out of the women's program into the men's program with soccer, he insists on having females on his staff for that exact reason. sometimes when you're having hard conversations with a player, it's nice to have both dynamics in the room. So if somebody's been injured and they're not going to play, or sometimes I'm like the mama bear. I could be giving them, relationship advice. I could be, so it just brings that whole other kind of chemistry into the situation.
Very cool. I never really thought about it that way. So it's really interesting to see how that kind of changes the culture or the environment in the medical room, right?
Yeah, it does. And, we were on an HPAC call for SPIN, which is a conference last week, which is through On the Podium. And one of the presenters was talking about, it was kind of on the issue of racialization and sensitivity and stuff like that. And was kind of talking about how in the treatment room, we as practitioners can take things to the next level for players. We were talking about the stats on abuse of power and stuff like that in sport. And though we deal on a healthcare level and on a musculoskeletal level, sometimes those conversations go a little bit deeper. And, that's one area where I found, and it could be because I'm chatty, but I often have athletes or patients disclose things to me that they may not feel comfortable with the male practitioner or, in certain situations. So it can just offer a different option, along the road for athletes. So.
Yeah, awesome. My last question is where do you see any potential opportunities for females in the field, or maybe any ideas that you may have to help promote female practitioners in the future?
So I think the interesting thing is I always say a big shout out to the girls of the RCCSS because we're rocking it right now. You look at like Courtney Brown, Jen Turner, Mel Lobes, yourself, myself, Lara DeGraw. Like we've got a really strong group of women who are kind of heading things up right now. And not that we haven't had a really great, strong group of males, because we do. We have awesome. And, I look at my mentors in the profession, like Greg Uchaz, Brian Seaman. They were the last group that got in with major games and were part of core teams. And we were left off of core teams for a long time. And, we've wondered why or what's different. And there's no difference in our education. There's no difference in our skill set. We all do the same things, but I wonder sometimes if the kind of emotional intelligence is a little different, or how we portray ourselves, or how, we connect. Connection, I think, is a really big thing in these environments, and that ease of being able to connect and being able to check your ego at the door, I think is a skill that I know as a female that is probably one of my strengths. I think there's opportunities when you look in the physio side of the sport world. There's a lot more females working in sport than there are. It's probably equal. And AT has probably been a little bit more male dominated, but now is a little bit more female dominated. So the opportunities are coming and they're there. And, when we look at on a professional level in sport, you look at people like Haley Wickenhauser coaching with the Maple Leafs, or you look at the female coaches coaching in the NFL right now. The opportunities are there and they're coming. Major League Baseball, the Jays had a head therapist who was female up until a couple years ago. So those, as kind of the cultures shift within teams, and I think, with everything that's happened in the past year and how conversations are happening, more doors will start opening. I don't think that somebody should get a job because they're a female. I think you should get the job because you're the best fit for the job and you're the best practitioner. But I do think that the opportunities of having a co-ed medical staff bring to the table can do nothing but benefit your organization. With Canada Soccer, we had an opportunity to go hang out with Alex McKechnie, who's the director of medical services for the Toronto Raptors. And Alex is just this well, he's a VP now of, I don't even know what his title is. He's a physiotherapist. He's originally from Scotland, came, he was with the Lakers and then has been with the Raptors. And his team that he has set up is very similar to how we have set up with soccer. He's got, a female physio that's with him. He's got a couple male athletic therapists, and that same kind of dynamic of having both genders there gives different opportunities for different players at different times.
In recent years, you've probably been the most active sports chiropractor, and definitely female, working at both international multi-sport games and then also working with national sports organizations. Can you just tell the audience about what your experience has been like working in each of these different roles?
Okay, so back up again. What are we talking about? HST for games, and then
yeah, basically looking at like what does that look like to be part of the health services team, and what does that look like to be part of the national sports organization? How do those different roles compare?
So they're very different. Sorry, I gotta get my mop up here out of the way. Usually in the HST environment, I'm the lone wolf. I'm often the only chiropractor that's named to the team because the core medical teams tend to be quite small. So when we go to major games now, Canada staffs a smaller team than they did 10, 15 years ago because most of the NSOs travel with their own medical staff. So we're there to support the NSO therapists, and we're also there to deal with the teams that don't have enough budget or funding to bring their own teams with them. So for example, for Tokyo, there are, I think it's 3 physios, 3 ATs, and 1 chiro, or it's 2, 2, and 1. Okay, I'd have to go back and check. Pan Am Games, I was the only chiropractor. Commonwealth Games, I'm the only chiropractor. And it's kind of a stressful position to be in, especially when it's the first time going. Often you'll get a comment that, oh, hope you do well this trip because you're not only here for you, but you've the weight of the whole profession on your shoulders. How you do in this games depends on if chiro gets back on the core team. So that's, and whether it's said in jest or whether, it's kind of the truth. So unfortunately with our profession, we get judged quite harshly, and we all know that. And I feel like we get held to a standard that tends to be a lot higher than other professions. This is my own opinion. This is not, this is not anything that's stated. But so it's kind of like you're under the microscope the whole time you go. So the first one was kind of, hold your breath, 4 weeks in Australia, say your pleases and thank yous, make ice bags, you do everything, but you come in, you don't kind of have your tribe. So you kind of have to find somebody in there who is friendly with your tribe. And thankfully for me in that first major games that I did, the chief therapist was an AT. Well, Dave Blatz, my head therapist, was Soccer Canada, and we hit it off like a house on fire. And so once you have someone, you always kind of have to have someone on your games team who's your go-to, who if you're having a bad day that you can bitch about it and you can know that it's not going to go anywhere, and vice versa, because the days can get long and the trips can get long. The other thing that's kind of exciting about it though is that it's a real opportunity to educate everybody that you're working with on sports chiropractic and what we can bring to the table. The nice thing about in those environments is that there's often a lot of collaboration, and you do get a bit of downtime. So, if there's something if the clinic's not that busy, you might have a rounds, kind of someone can say, oh, I'm a dry needler. Do you want to know how I do this? Or I do a lot of soft tissue manual therapy. I'm an ART person. So there's a lot of information sharing, which is really interesting. And then you get the NSO therapists who start cycling through your clinic as well. And with that group, you get a very diverse group of practitioners. Ron Madison is one of the physios with Swim Canada. And if you don't know who Ron is, look him up. He's phenomenal. An absolutely unbelievable manual therapist. He is a shoulder guru. He teaches courses all over the place. So Ron was in Commonwealth Games, and he was in the clinic one day, and it was quiet, and he was bringing his swimmers in to treat. And I sat for about 3 hours and just watched him and asked him questions and picked his brain as he was working through his athletes. And that kind of experience is amazing, and then you get to kind of banter and say, well, I do it this way. What do you think of this or this or this? So it gives you really interesting opportunities. You have to be a little more cautious as a chiro in those settings. Some of your colleagues may be a little nervous about chiro. Manipulations, particular C-spine stuff comes up a lot, of whether you should adjust or whether you shouldn't. I tend to err on the side of caution in those environments, mostly because when you get to a major games, your job is not to fix things. You know what I mean? Your job is not there to make major change. Your job is to support an athlete who spent the past 4 years training to get to this point to get on a podium. Mm-hmm. So if I do something, that's where your ego has to get out of the way. And you say, you might look at something and think, God, that pattern's funny, or God, I could really help here. No, your job is to make them feel good, to deal with any minor injuries that come up along the way so that they can be successful on the podium. So that's a little bit different role in the HST setting. What typically happens is that Commonwealth Games is a minor games. So once you get named to the Commonwealth Games, your chances of getting named to Pan Ams and then to Olympics goes up because you're working with the same group of people. And they kind of try to keep it similar through a quad, like, ending in the summer games. The nice thing that has changed with chiro on core teams is that as of me going in 2018, we're allowed to do field of play coverage. So before then, chiro was they were only in the clinic, never had field of play. But I was always assigned my own teams all the way up through. So that's a change in the education piece and the hard work that we've done to kind of show as, we are first responders as well as, our clinical skills are there to do field of play. So that's good.
That's cool. I didn't know about that.
Yeah. And that's a big shift. A huge kind of recognition, and it divvies things out. So Commonwealth Games, I covered weightlifting, I covered diving. I did a little bit of beach volleyball with Dave. Pan Am Games, I had the weightlifters again, and I did some badminton. So that's fun because you get to go to the venues with the athletes. The difference between HST and NSO is that at the HST, they're your athletes, but they're not your athletes. So they have other people that they work with all the time when they're home, or they have other people. So you're kind of have to fit in where someone else has been through a whole training cycle. When you work with the NSO, they're your athletes. So you typically tend to be on most of the trips. You build your relationship with those athletes, and you've been through the ups and downs with them. So that's a bit of a different position. I find that I love working with the Olympics and I love working core, but our medical team with Canada Soccer has my back, right? You're part of the team when you're part of an NSO. You're on the field when everybody cheers, you're crying when we lose. You feel every up and down. Whereas when you're at the Olympics and you're with the teams, you don't have that same relationship with your athletes or your staff.
Yeah, right on. One of the things I wanted to ask about is there's a multidisciplinary setting there, and you talked about some of the different collaboration and time to be able to learn from each other. But how does it actually work as part of that multidisciplinary setting? So, for example, how does an athlete decide to go to a certain practitioner, or how is it decided that an athlete will see a certain practitioner, and then is that shared between different providers?
So how it's triaged and how who gets to see who.
Yeah.
So if somebody comes in with a new injury, it's assessed by the sport med physicians first. Just, as long as it's not, if it's something that they've been dealing with for a long time, chronic issue, they normally get treated, then they can come and check in on the therapy side. So usually the clinic is kind of, separated a little bit to the medicine side and the therapy side. If it's a new injury, always gets triaged by med first. And then it's kind of, they can make a recommendation of whether it just goes to therapy, and therapy decides what discipline or who's going to be seen first. At this level, everybody is considered a therapist. So first and foremost, so AT, PT, Chiro, there is a lot of overlap and there's a lot of shades of gray between what we do. Within that group of therapists, there's those of us who have different skills. So obviously, me being a Chiro, manipulation, ART, some of my manual skills kind of top out over others. Some of the physios are dry needlers and they do a lot of dry needling. Some people prefer KT taping. Some people prefer modality. So kind of within that, you figure out within your group who's kind of what. So the clinic is open from 7 a.m. till 11 at night. So there's usually 3 shifts that get covered, and we divvy that up between us during the day. So there's usually 2 therapists on per shift. So if somebody comes in, I might see them as an intake and go, okay, this is what I can do for you, but this is what we're going to do today, but I need you to see this person tomorrow. So it kind of gets triaged that way. You kind of sort it out from, if somebody comes in and they're like, I always get this, I get a lot of people who are used to seeing Chiro and will come in and say, I need to get adjusted. Those go directly to me. Or people who, typically know exactly what they're looking for. For the ones who kind of don't, then we just triage with whoever's on and figure out. It's interesting because some of the smaller sports don't have a lot of experience with healthcare. So shooters at Pan Am Games, we had a lot of bowlers and lawn bowling and 5-pin bowling, sports that you would not normally see. At Pan Am Games, they have a lot of really strange sports, like roller figure skating, skateboard. We had surfing last year in Peru. This is the first time Canada Surf was there. So a lot of this whole healthcare system is just completely new to them, and they don't actually have people they don't have an IST. They don't have people that work with them. So it's a real education to them of, oh, okay, this is how we can set things up. So.
Awesome. I think we're going to jump ahead to the next section here, which is next questions. So these are basically rapid fire questions that I'm just going to ask you quickly, and if you can just kind of shout out the answer for them. So Janice, where are you practicing?
St. John's, Newfoundland.
And where did you grow up?
I grew up technically I'm from a small town called Portugal Cove, Newfoundland, but we'll just call it St. John's. Once I got out of elementary school, that's where I live.
Yeah. What are your hobbies?
So I have a little bit of a photography habit, which is what keeps me sane. It gets me away from people. So I like kind of chasing whales and zodiacs and being out in the woods. And now that and some hiking is pretty much all that I have time for. So
yeah, great hobbies.
And you have a separate Instagram account for that, don't you?
I do.
I think I saw that once. Yeah. Awesome.
Yeah. Here's some of my whales. They're up on the ceiling.
Nice.
Awesome.
Yeah.
What is one of your favorite moments as a sports chiropractor?
Oh, okay. So I have 2.
Yep.
Hands down, Dave Simon, you can agree with me on this. Beating USA 2-0, BMO Field in Toronto last October. Best feeling ever. That one will never go away. Anytime you beat the US, especially on home turf, is pretty amazing. Another one is kind of, sometimes it's not about the sport, it's about the people, right? And so Gold Cup is a tournament that we play with soccer that can be a bit grueling. And we had a big match against Haiti, and one of our players is of Haitian descent. And I was in the locker room at the end, just before he was going out. And super quiet kid, doesn't say a lot. And I look up and he's at his stall with a rosary praying before he goes out in the field. And it was him and myself and the coach in the locker room. And I looked up and I caught the coach's eye. And the two of us welled up. And this kid walks out on the field. And he's a very quiet, humble kid. And it was in that moment that I got it for him. You know, that's his life. That's his world. And he was going out. He was a descendant of that country. He'd spent some time there, and it was a tough game for him. And, you know, it's those little things that you get, those little insights into people that you normally wouldn't get. That moment with him, I'll never forget.
Have you kissed the cod before?
I don't have to. I'm from here.
Okay, well, how many people
have you when you're not from here?
How many people have you screeched in?
God, that's a good question. Anybody who comes definitely gets screeched in. So, you know, apparently the screeching in is a little different now during COVID.
Fair.
Everybody can't be kissing a cod. There's one bar that does it where they kiss a puffin. So we had, I think it was 2007 CASM meetings were here. And a bunch of our RCCSS people were here. Chris DeGraw was here, Scott Howitt. Anyways, so they all got screeched in on that trip.
Nice.
Yeah.
What is your favorite meal?
Oh God. Anything anybody else cooks.
Seriously.
Spoken like a true mom.
Yeah.
Who did you have for clinicians at CMCC?
I had Tony Tibbles. I had Lori King. I had Glenn Harris when he was a resident, and he scared the daylights out of me.
So some things never change, eh?
Yeah, some things never change. He actually wrote me up because I think I treated somebody without getting a signature, and I had to write a formal apology to him. Never forget it. Now, it was different when I was in clinic then, because we didn't have to have certain clinic numbers per each semester. So I was at Wellesley, which is Sherburne now. So I literally got all my clinic numbers done in 6 months. So I had Lori King was the clinician at Sherburne at the time at Wellesley, and she was on maternity leave. So I had Tony Tibbles first with Glenn, and then Lori. I can't tell you who my clinicians were for the last 6 months in clinic because I don't actually think I was there.
Last up, who should we have to interview next on RCCSS chats?
Oh gosh. I always love a good interview with Courtney Brown because she's doing some interesting and different things, especially with her, you know, experience with Alpine Canada.
Absolutely.
You know, and brings another kind of different perspective. Jen Turner is another one who, you know, of course, the kind of female perspective. But then, you know, some of our kind of older guys it'd be great to hear from. You know, the Brian Siemens, Greg Uchazes of the world bring an experience that, you know, what they did set up the path for what, you know, Chris DeGraw, myself, Scott Howard, Padge, you know, that generation has done. And, you know, hopefully we're kind of starting to open the doors for you guys. So it would be interesting to hear their perspective and to see if they think are doing an okay job with what they left us.
Yeah, fair. I mean, that'd be an amazing learning experience for Mel and I too, because that's like, I don't really know those guys at all. And it'd be great to learn from their stories as well.
Oh my God, fabulous practitioners, tons of experience, you know, great mentors in this organization. So.
Well, thanks for that. If we're going to open it up for any audience questions there, if anyone has any questions, feel free to type them over to Mel. Let's wait a little bit there.
I think we might be good on the questions. Unless, Janice, you have any kind of final thoughts, comments?
No, I think I talked enough.
Well, Janice, thank you for taking the time to participate in this episode of RCCSS Chats. If our audience members have any more questions, what is the best way for them to reach you or possibly see some of your photography?
Oh, so Instagram, I have 2 Instagram accounts. So my JD Sport Cairo is for all things work related, all things Sport Cairo related. Hopefully that'll get a bit busy again soon in the new year if quick testing comes out and we can travel again. Yeah. And then what's my other one? I think it's JDDC, or email through my website through the RCCSS. I'm pretty easy to get a hold of.
Awesome. And thank you to everyone who tuned in for the live session. This and other episodes can be found on YouTube by searching RCCSS Chats. Have a great night, everyone. Thanks.
Thanks very much.
Thanks.